Well, hi there. Warm welcome. You're watching Times Now's Blueprint Explosive Exclusive, and I'm Meghna Deka. Lots lined up for you in this bulletin, but today we are going to talk about a very critical issue about our choices and also, unfortunately, the regression which seems to have seeped into the mindset of the society. But remember, it has been 6 years since the Supreme Court decriminalized homosexuality in the country, ushering a new era of progress. But in a shocking turn of events, the National Medical Commission has now revised its curriculum for this year for undergraduate medical students, reintroducing lesbianism and sodomy as unnatural sexual offences. Now, this is interesting because the revised curriculum does away with the distinction between consensual sex between queer individuals, adultery and offences such as incest, and a lot of these which are, of course, criminal offences. Something which has essentially been decriminalized in the Supreme Court, however, has now been brought back. Remember, in 2022, the entire syllabus was in fact tweaked so that it was a bit more friendly to the LGBTQ+ community. The curriculum was also brought back subjects such as the importance of the hymen, the definition of virginity, as well as legitimacy in medical legal importance as well. So the revised curriculum, meanwhile, does away with the 7-hour training about disability as part of the foundation course as well. And it also does not include subjects on disability in its module on medical ethics, a point which has been raised by the disability rights activists as well. So the rights groups are up in arms against the revisions. They have now penned a letter to the health minister as well, demanding that the revisions be recalled and that the changes are in violation of 2 of the laws of the country.
The new curriculum is full of mistakes which are not in line with the Honorable Supreme Court judgments, the Rights of Persons with Disabilities Act and the Transgender Persons Protections Act. We have written multiple letters earlier in April to the National Medical Commission how to make it more streamlined with the best international standards, but they have not paid any heed to it. Moreover, they have removed the best practices of disability rights as disability competencies from the foundation course. It is very heartening to see that across nation there are disability groups, queer groups, trans groups who have come up to show cross-movement solidarity against this illegal and archaic initiative from the National Medical Commission. We have written a letter to Honorable Health Minister of India asking for his intervention so that he can direct the National Medical Commission.
So today we have on our show Dr. J.A. Jayalal, the former national president of IMA. Also joining us on the show, Satendra Singh. He's with Doctors with Disabilities and Agents of Change and the director as well as a professor at UCMS. So let me first start with you, Dr. Jayalal, because it's very disturbing because we are having this conversation, interestingly, 6 years after the Supreme Court has decriminalized homosexuality. This comes 2 years after the Madras Court asked the syllabus to be made more LGBTQ friendly and the revisions have taken place. Today, how is it that India's apex watchdog when it comes to medical curriculum is going back to the era which is over 6 years back? Why are we taking 1 step forward and 6 steps backwards?
Yeah, I fully agree with you because as a medical doctor, we are not judges. We are not going to take a moral policing on the people. What is that legal? That is the only thing we are going to follow. And it is prudent on the part of the NMC to the curriculum. This plus and minus of this, both the concept they can put it for. And with a non-judgmental approach, with the compassion is the norms which is being required for that. So in that sense, what is now the new curriculum which has been put forward by the NMC is definitely it is not what is expected. We all, most of the faculties are also written to the NMC that this is not in line with what is the purview of the medical students and it should be removed. But the more the concern is also raised on that because now the new BNS, the section 377, the IPC 377 is totally removed.
Absolutely.
The 377, the direction is given by the Supreme Court. The consensual sodomy and lesbianism is not criminal. Absolutely. But we are now concerned since there is no law. If there is a man is doing torturing a male above the age of 12, POSCO above the age of 12, if there is a sexual assault on a man by a male, There is no law today to put him in any way to punish that. That we cannot accept. A man putting a sexual torture to another man. So that comes under the sodomy. That. So when we totally say that is sodomy and lesbianism is accepted and we cannot go on that, that is also a wrong side of that, because it has to be there. And the consensus is different. Like what we are saying in the POSCO, even if the consent, it is wrong. So there must be, the government needs to now come in the BNS. There has to be a section to be brought in. Equally, we request the NMC that please roll back this, and this is not in line with what is the taste of the.
If you can, in fact, Dr. Jayalal, since you're talking about the NMC, you must explain to us, to the layman, for people like us, we are trying to understand if the courts have made this order. I take your point on the BNS, maybe silent on certain aspects of it, but the Supreme Court of India has made it very clear that there is decriminalization of homosexuality, which happened 6 years back. You have the Madras High Court order, which has spoken about the revision. How can the NMC retweak and change the curriculum and make it more regressive? Who's heading it? How does it go about it? Are there no checks and balances about what is being taught? Because at the end of it, this is what students, undergrads of forensic sciences are going to be learning. And this may, in the long term, lead to legal and criminal ramifications as well.
Absolutely true. But the syllabus and curriculum is always on a dynamicity. And it is always in a change, because what we were taught 10 years back or 5 years back is not what is there in the science. Even if you see in each new edition of textbook is coming, the concepts are changing. But now this is, unfortunately, as a retrograde step, it has been brought in. Now this is now brought to the knowledge of the NMC, and definitely I believe that they will be reconsidering this and put it in an amendment to be, that will be put on that. So this is only a dynamic concept, and I wish the NMC curriculum should not put on that this is right and this is wrong. We are not here for the judgmental, but this should be only put on that issues of that medical point of view. See why this concept has come, because the HIV and AIDS were spreading more. And there was some feeling that it may not be true, but there are feeling that sodomy, and this is one of the reasons for that. Now again, now we are on the decline of HIV. At this moment, bringing back, it is unfortunate. We all support we compassionately supporting the people with the disabilities.
Appreciate
and this
that.
Definitely we will put forward our views on this.
Well, I appreciate that, absolutely. However, the fallout of that, of course, I agree with you, Dr. Jayalal. This is not about doctors making a decision whether it should be criminal or not. But if they are being taught at the undergraduate level that lesbianism and sodomy, and making no difference between whether it's consensual or not, if they are being taught that this is unnatural, what could be the legal fallout of that? We would really lie on what presentation and representation is being made in the court by forensic experts, which was the limited point. Of course, I agree with you, however. Dr. Satendra Singh, now the other issue that we are dealing with, and this is a very serious issue, especially when worldwide there is so much of talk which has happened about how to make this place more disability friendly, to ensure that those with disability are dealt with sympathy, empathy, and more importantly, understanding. How can we have these kind of tweaks being made, again, by the NMC, which are completely unfriendly to the entire cause? Best practices in disability rights itself have been tweaked. How can that happen? How is this allowed to happen?
Yeah, so traditionally, the understanding of disability, globally as well as medical textbook, is that it is from a deficit-based perspective. That if somebody has an impairment, or it is also true for people who are transgender as well as the intersex variations, if somebody has a variation, because I'm a teacher of physiology, I teach first-year medical students, and it is not only an issue only in the forensic medicine, even in the textbook of physiology, in the curriculum of physiology, intersex variations are still considered as quote-unquote abnormality as well as disorders. Now, we all know the example of, our silver medalist at the Doha Asian Games, Shanti Sarajan. And her medal was stripped off because nobody had a clue. Even the athlete had no clue that she was having androgen insensitivity syndrome, a medical term of intersex. Now, if you classify these things as disorders, that is what the harms is, because, you are not aware of the ethics also, you are not aware of the autonomy also. Moreover, what are these disability competencies which I'm talking about? If I explain to a layman The short answer is that when somebody who is in a wheelchair, he goes to a hospital, how he is being treated. I myself a doctor, so I understand the issues. Not all people with disabilities are patients. Many of them wear stethoscopes like us. So when a wheelchair user goes to a hospital, many a times, even if he has a cold and cough, people give unsolicited, doctors give and nurses give unsolicited advice on that your limbs can be corrected. Have they asked for that? Similarly, when you are interacting with a deaf person, right, you don't always need a sign language interpreter. You only need to know the basic thing that, people who are having hearing impairment, they can also lip read. So you don't have to put your laptop in between a patient and a doctor. Similarly, many women with disabilities who go to hospitals, many a times, they are not being asked about their sexual history because they are considered as quote unquote asexual, that they do not have an active sexual life, which is not true. So that's what I'm saying, that globally we are moving from accepting disability as a form of diversity human variations. Now we have a new disability act. We have 21 type of disabilities. Do we know all of them? The government of India has already started a cell disease elimination program. We're talking about Viksit Bharat, but we will not be able to achieve that until and unless nobody is left behind, which includes people with disabilities, intersex people, transgender people, and people with different sexual orientations.
Well, absolutely. Couldn't agree with you more. How can we talk about inclusivity if there are certain sections who are being left out of it? Now, Satyendra Singh, Dr. Singh, you have raised one of the very important issues. It's not just about accessibility, but also what is going to be outcome. You must explain to us, what should the NMS do now? What should be added to the curriculum and what exactly has been tweaked in the current curriculum, if you can explain to us?
See, already, because when 2019, the new curriculum came, there was nothing on disability rights into that. It was based on our advocacy. We gave them the module. There are 7 hours which we prescribe based on interaction with a global, pan-India consultations and all that. That thing was already there. They only have to reintroduce that. Now, what they have done is that in 2 weeks of the foundation, they are saying that 8 hours of sports is necessary, but there is not even a 1 hour of gender sensitization or disability sensitization. Is it correct approach?
Absolutely.
We have already given them all things which are needed. What they need is that they have to shed off their ego, high arrogance, which is there. NMC is not interacting with anybody. Medical educators, we, the medical teachers, are the main stakeholders for carrying forward this curriculum, competency-based curriculum. More importantly, where are the voices of students? This curriculum is for students. Have you asked them, the Generation Z, what they think about these issues?
Absolutely.
These archaic things are from the NMC, and do you look at NMC? Have they occupied all of their posts in their undergraduate, postgraduate, and ethics board? Many of these posts are, vacant. People are not there. And they think that they are
Dr. Jayalal, do you agree that one of the problems, do you agree or do you disagree with Dr. Singh, who says that one of the problems is with the NMC? Arrogance needs to be shed. There needs to be more interaction with the teachers, the professors, as well as the students who are coming in.
There is 2 things, because we are talking about the foundation course. But please understand, now in the whole of medical curriculum, even the word disability we are not using. We are using the term specially enabled people. So anybody who comes with a person, it is not that we are going to put them as a disabled person. We are going to call them specially enabled people. They have a special talent. So even I will be agreeing with the NMC in that sense, when we are removing the term disability certificate, disability or something like a disability orientation, it should be always, and on the other hand, we are introduced the ATCA module, which talks about how you are going to have the attitude and communication and ethics. And ethics has become a mandatory part of it, and where they are teaching about autonomy, beneficence, maleficence, and how the people are going to approach it, irrespective of that, whether you are a specially enabled person, a differently enabled person, or you are a normal person, the ethical approach is going to be the same. We need to have the autonomy for the person.
Okay. Dr. Satyendra Singh, you wanted to come in?
Yes, I have a counter, and this is the entire reason why we are talking about disability rights. We are not normal or abnormal people. We are not specially abled. We are not differently abled. I have a very strong objection to this globally, and the WHO has recommended it. The United Nations have said that there is nothing wrong with people with disabilities. And that is the entire thing why even the Supreme Court are coming up with a guideline on people with disabilities. You have to ask the people with disability of this country, and that's what I don't agree with you, Dr. Jayalal. I'm sorry. And that is why we need to shed away this pejorative word.
Okay, the etymology aside, when it comes to correction, I think all of us are in agreement there that a correction is required, especially if it is coming in from India's apex medical education watchdog, the regulator. That correction needs to be made because it cannot be going at a parallel timeline. If times have changed, if Supreme Court orders have come in, Madras High Court's order in, how can the NMC add riders such as this, remove parts which should have been very significant to deal with today's day and age, the kind of problems that have come in, and also more importantly, because it adds directly and links directly to criminality. Well, thank you so much for joining us. This has been a very interesting conversation. Dr. Jayalal, appreciated, as well as Dr. Satendra Singh. We hope that from here onwards, the NMC is going to be a bit more responsive to the kind of complaints which have already gone in. Of course, complaints have gone in to the Health Ministry as well, and they're going to step in and correct and hear the professors as well as the students who are going in. Well, on that note, we are going to be slipping into a short break. Don't go anywhere. We are going to return in 2 more minutes. Do stay tuned.